For most kids who completely dread public bathrooms, it actually isn't the toilet they're terrified of, it's the hand dryer. It's that sudden, deafening, totally unpredictable blast of air. Today, we're going to dive into the science of decreased sound tolerance and explore exactly why an everyday environment can feel like an absolute acoustic minefield to a child. Now, the National Health Interviews Survey uses a really simple screening question for this. They ask, do everyday sounds seem too loud or annoying to you? And if you're a parent of a kid with sound sensitivities, you already know this isn't just a minor annoyance. It is literally the barrier between a normal, quick trip to the store and a complete, overwhelming meltdown. Because we're not talking about rock concerts here. We're talking about the roar of a hand dryer firing off without any warning, the sudden whoosh of an automatic flush, or even just household triggers like vacuums and hair dryers. These normal, everyday things are setting off profound distress. So let's break this down in Section 1, Differentiating Sound Sensitivities, the Clarity Cascade. First up is hyperacusis. This is a physiological issue of volume, where loud sounds actually cause physical pain, and troublesome hyperacusis affects roughly 3% of typically developing children. So to them, a hand dryer isn't just noisy, right? It physically hurts their ears. Misophonia, on the other hand, is a bit different. It triggers intense emotional reactions to very specific sounds, regardless of the volume. So a child might be totally fine at a really loud playground, but then experience this overwhelming fight-or-flight distress at just the faint sound of a sibling chewing, or maybe a specific frequency humming in that public bathroom. Then there's phonophobia, which is the anticipatory fear of a loud sound happening. And this is exactly why public bathrooms are the ultimate trigger. They basically combine the physical pain of hyperacusis, the specific triggers of misophonia, and the agonizing phonophobia of just standing there, waiting for an unpredictable automatic flush to go off at literally any second. Finally, we have general noise sensitivity, which is just this feeling of being completely overwhelmed by a noisy environment. Now, if you're seeing intense and generalized sound sensitivity in children, it can often point to a broader sensory processing or autism profile. And that's something that really benefits from a professional assessment. The dividing line here is absolutely crucial to grasp. Think of hyperacusis as a loudness dial that results in actual pain, whereas misophonia is a highly specific emotional trigger. Understanding this distinction is vital for parents who are trying to decode exactly what is hurting a vulnerable child, especially when that child might not have the words to explain it themselves. Moving right along to Section 2, let's look at hyperacusis and autism spectrum disorder. We noted earlier that this affects about 3% of typically developing kids. But for neurodivergent children, this number is just staggering. 60.58% is the estimated lifetime prevalence of hyperacusis in individuals with autism spectrum disorder. When you compare the general population's roughly 5.9% to the ASD population's 41.42%, the scale of this issue becomes undeniable. If your child is covering their ears or having a meltdown, they are not alone, and they are definitely not just acting out. This is a highly prevalent, true physiological reality. And clinicians aren't just guessing here. They use gold standard tools like the Autism Diagnostic Interview Revised. It asks parents about consistent, long-term oversensitivity to totally mundane daily sounds like traffic outside or a washing machine running, rather than just a typical sudden startle response. Which brings us to Section 3, Measuring the Impact on Daily Life. Make no mistake, unmanaged sound tolerance literally shrinks a person's world. While adults might face severe workplace difficulties, for families, it often means children avoiding school activities altogether. It means increased caregiver burden and just immense anxiety when you're simply trying to use a public restroom. A noisy environment very quickly becomes a hostile environment. So what do we do about it? Let's check out Section 4, Clinical Management and Therapy. Clinically, professionals will start by ruling out baseline hearing loss. But for parents in the trenches, your immediate plan is threefold. First up, predictability. Warn them before the hand dryer goes off, or just stick to paper towels. Second, offer ear protection for those highly unpredictable environments. And third, start working on graduated exposure to the sounds at a completely controllable volume. Also, a quick note, if the sensitivity is really intense and generalized, absolutely go see a professional for an assessment. Now, when you do see a professional, they'll use tools like the Tinnitus and Hearing Survey to listen to your specific examples. They map out whether your child is dealing with physical pain, an emotional trigger, or that anticipatory dread we talked about. Your narratives as parents are literally the key to picking that clinical lock. Thankfully, there's a really diverse toolkit out there to help retrain the brain's reactions, like CBT and systematic sound desensitization. These therapies focus on desensitizing the physiological processing of sound, giving patients a mental framework to decouple the sound from their anxiety. But honestly, the most important step? Validating counseling. Just confirming to a child that their pain is real is a massive therapeutic win all on its own. So if your child is hiding from the hand dryer in the bathroom, know that their experience is a validated physiological reality. Our approach here isn't to just tell them to calm down. It is to conquer. Tools like the Fear Me Not app are actually helping kids climb a gentle ladder toward the very sounds that used to send them running. Armed with this science, how will you help your child conquer their noisy world today?